Welcome back to Practical Pediatrics for Parents, where you can find videos to help keep you and your family healthy. In this video, I'm going to talk about strep. Strep refers to a bacteria called Streptococcus. There are many different types of Streptococcus that can cause a variety of infections, including pneumonia, infections by flesh-eating bacteria, vaginal infections that can get passed on to babies at birth, and an infection of the posterior pharynx that we call strep throat. Strep throat is very contagious, and it's easily spread by airborne droplets, by touching a contaminated surface, or by direct contact with someone who has strep. 2 to 5 days after you are exposed to strep, you might develop symptoms, including fever, sore throat and pain when swallowing, red and swollen tonsils, white patches on the tonsils called exudate, small red spots on the roof of your mouth called petechiae, swollen lymph nodes in the front of your neck, and there are other symptoms that patients with strep might develop, including headache, abdominal pain, nausea, and vomiting. And some people with strep throat will develop a rash called scarlet fever, where you get fine, red, raised bumps that start on the face or neck and can spread to the chest, trunk, arms, and legs. Strep throat symptoms do not include cough, runny nose, or hoarse voice. These symptoms are usually caused by viral infections, and these do not respond to antibiotics. Because the symptoms that we see with strep throat can also be caused by viruses, doctors rely on a strep test to make the diagnosis. The doctor or nurse will swab the back of your throat and run a test to determine if you have strep. In the past, we had to do a throat culture to determine if you had strep, but these took several days before we had a result. We now have rapid strep tests that are very sensitive and specific, so there's no longer a need to do a throat culture, and we can know if you have strep within a few minutes. If your test is positive for strep, your doctor will prescribe an antibiotic, and usually within 1 or 2 days, the symptoms are much improved. To make sure that you get better and that you do not spread strep to others, be sure to take all of the antibiotics as prescribed. Do not go back to school or work until you have been on antibiotics for at least 24 hours. Wash your hands often. Avoid sharing dishes, cups, or utensils with other people. Don't keep your toothbrush near other people's toothbrushes. And 2 to 3 days after starting antibiotics, you should throw away your toothbrush and start using a new one. Any people that you have had contact with who do not feel well should be tested for strep. If you have strep throat and don't get treated, you run the risk of developing complications, such as an abscess in your tonsil, which might require surgical drainage, rheumatic fever, which is a disease that can affect the heart, joints, brain, and skin, or post-streptococcal glomerulonephritis, a kidney disease. Call your doctor if you or someone in your family develops sore throat accompanied with tender, swollen lymph nodes, sore throat that lasts longer than 48 hours, fever and sore throat and a rash, problems breathing or swallowing, or you were diagnosed with strep and you're not getting better after taking antibiotics for 48 hours. Thanks for watching Practical Pediatrics for Parents. I hope that this video and others on this channel help keep you and your family healthy.